Hi everyone, welcome back. It's 9:21. As men and women age each decade, their bodies need different supplements to help them stay healthy. Here to explain nutrient matching, we have Dr. Kecia Gaither here, a double board certified physician in OB-GYN and maternal fetal medicine. First of all, thank you so much for being here.
Thank you for having me.
I know you took a trip up from New York to join us. Thank you. So this is very interesting. What do you mean generationally? I mean, do our bodies change? How does this happen?
Our bodies do change, and while I'm talking about different supplements for the different ages, you can take them at any time, but I really want to stress certain things. So in the 30s, when we're all thinking about having a baby, one of the things that I think is really important for men and for women is vitamin D. Now, vitamin D is made in our skin in conjunction with sunlight. So for women who are of a darker hue or are living in climates where there's not a lot of sunlight, it's important to take vitamin D. One of the other things that's important in pregnancy, vitamin D has been correlated with decreasing the risk of preterm birth in women whose levels are between 40 to 80 nanograms per deciliter.
Oh, wow, okay.
During pregnancy, calcium uncouples from vitamin D. Calcium is going to your baby for bone growth, and you become deficient in vitamin D, so it's important.
I'm always wondering what we can do more for our babies, so that's important.
Absolutely.
Thank you.
I currently am on the Medical Scientific Advisory Committee of Organic and Natural, which is a company and organization that is really predicated to promoting nutritional supplementation. So vitamin D is important for ladies. For men, vitamin D is important for fertility as well, as it enhances the development of normal sperm.
Wow, okay. How about 40s?
40s, for women, we start becoming more inflamed. We start having more and more issues with aging, skin looking, sagging and so forth and so on. So omega-3s are really good with that. Omega-3s are really good at decreasing the inflammation in our bodies, enhancing our skin tone and so forth and so on, and decreasing your incidence of developing cardiovascular issues.
Wow, okay. 50s?
50s for women, I want to talk about vitamin C. Vitamin C is really good, again, for the aging of the skin and also for decreasing your risk of developing or being exposed to colds and flu. I mean, we're in the season right now where vitamin C supplementation would be really good. For guys, vitamin B12 is really important as it maintains strength and DNA and muscle tone and so forth and so on. So it's really good.
Now, before you start incorporating anything new into your diet, you probably should be talking to your doctor?
You should be talking to your doctor. I think it's really important that you have your levels checked, particularly of vitamin D. And one way that you can do that, you can ask your doctor directly, or you can get your own kit. There is a site called nutrientpower.org where you can get your little kit, and it can test you for not only vitamin D, but for omega-3 and, MAG. It's also a site where you can get a lot of information on the various needs for supplements and what you should be taking.
I like it. And if you are deficient, this is the type of thing you can find in like a Vitamin World or CVS or anything like that. Wow, great. Doctor, thank you so much for being here.
Thank you for having me.
Helping us live a healthier life.
Yes.
Thank you so much for your time today.
Thank you so much.
All right, we're going to send things over to Keith in the kitchen.
All right, Hutch, we're going to sweeten up your life right here. We have a real treat here in the kitchen because